Vitamin D, a miracle vitamin? Good for the bones, for the heart. Vitamin D would also have properties against cancer and cardiovascular diseases. What are the risks of a vitamin D deficiency? How not to be deficient in vitamin D? When should I take a supplement? Vitamins such as C and E continue to be the darlings of many supplement lovers. But these vitamin superstars are forced to share their throne with the long-neglected vitamin D, which is finally getting the attention it may have always deserved. You may be familiar with vitamin D's role in promoting bone health, largely by aiding calcium absorption. Vitamin D deficiency, especially in later life, can lead to osteoporosis or osteomalacia, bone softening, says Lona Sandon, registered dietitian and nutritionist, assistant professor of clinical nutrition at the University of Texas Southwestern in Dallas. But recent and growing evidence links low levels of this vitamin to an increased risk of type 1 diabetes, muscle and bone pain and, perhaps most seriously, cancers of the breast, colon, prostate, ovary, esophagus and lymphatic system. If you want to lower your blood pressure, vitamin D may be just what the doctor ordered. If you are trying to reduce your risk of diabetes, heart attack, rheumatoid arthritis or multiple sclerosis, vitamin D should be at the top of your daily supplement regimen. On this channel, we approach health from a global point of view by working on the 4 pillars of health: diet, physical activity, mental health and sleep. If you are not yet a subscriber to the Top Fitness Health YouTube channel, consider subscribing, and if you want to be notified when a new video is released, consider activating the little bell. Vitamin D is good for bones, muscles and the heart. Vitamin D is an essential vitamin. However, nearly half of the population lacks it. Some vitamin D is endogenous, which means that it is produced by our own body, at the level of the skin thanks to the action of the sun's ultraviolet rays on cholesterol. Another part is exogenous, which means that it comes from an external source, in this case our food. Vitamin D is found in most foods. The richest are fatty fish, cod liver oil and certain plants such as mushrooms. Vitamin D acts at the level of the intestines and kidneys to absorb calcium and phosphorus and allow its fixation on the bones. In other words, vitamin D is involved in bone growth. Vitamin D deficiency therefore causes rickets in children and problems of bone loss in adults with an increased risk of fracture. But this is not the only role of vitamin D. Vitamin D receptors are found throughout the body, whether in the cardiovascular system, neurons or the pancreas. Not to mention its role in immunity. Babies particularly need vitamin D because it is during early childhood that the solidity of the bones is acquired. It is therefore sometimes necessary to supplement them with vitamin D. Giving vitamin D to babies plays an important role in their growth. It favors the absorption and the fixation of calcium, essential to a good mineralization of the bones. Every day, infants should receive 1 milligram of vitamin D until they are 18 months old. To fight against these vitamin D deficiencies before and after 18 months, pediatricians remind parents of their needs as soon as possible. Dr. Eric Sabin, a pediatrician, recommends that his patients give their children vitamin D ampules every 6 months, regardless of age, until the end of growth, after the onset of menstruation for girls and until 16 or 17 years for boys. Children can now rejoice because today's ampules are much less difficult to swallow than the vitamin D-rich cod liver oil of our grandmothers. Vitamin D is present in our epidermis. Under the action of the sun and UVB, it is activated and synthesized by our body and then stored. But in our latitudes, winter is long and the sun is capricious. Gloves, hats, scarves. Our body shelters under an armor of clothing the little time we spend outside. Our skin does not process enough of this vitamin. A deficiency in vitamin D, from the first years, will have consequences much later. Vitamin D is used to absorb the calcium that we ingest. If we do not have enough vitamin D, we will not absorb calcium properly. Vitamin D is also used to fix calcium on the bone. All in all, we will have a bone that will demineralize and that will favor subsequent fractures, especially after menopause in women, because it is in women that the risk is the greatest. This is why young girls between the ages of 10 and 18 must absolutely take supplements. According to the doctor's observations, vitamin D deficiency is also the cause of certain diseases. A vitamin D deficiency could promote certain cancers or diabetes. It could act on the immunity with a susceptibility either to infections or to immune problems. We know that vitamin D plays a major role in growth and bone mineralization. But according to scientists, it would also help fight the coronavirus by helping the proper functioning of our immune system. Vitamin D helps fight respiratory infections. A study done by professors from the University of Liège in Belgium states that vitamin D would also be a way to protect ourselves against the coronavirus because it would help our immune system to fight respiratory infections. These researchers referred to a meta-analysis published a few years ago in the British Medical Journal, which showed that vitamin D supplementation had a protective effect against acute respiratory tract infections, especially in people who were highly deficient in this vitamin. We know that our body is able to synthesize vitamin D if it is sufficiently exposed to the sun. Under the action of UVB rays, it transforms a cholesterol derivative into vitamin D, but in winter, the number of lux is not sufficient. It is therefore important to rely on food sources of vitamin D. What is the difference between vitamin D2 and vitamin D3? Vitamin D is a fat-soluble vitamin that exists in two forms, D2, produced by plants, and D3, by animals. In humans, these two forms have the same biological activities since they are converted in the body into the same substance, commonly called vitamin D. However, D3 is better assimilated than D2. It has twice the action for an equivalent dose. What does vitamin D do? By increasing the absorption of calcium and phosphorus and limiting their leakage into the urine, it is essential for the mineralization of bones and teeth. A vitamin D deficiency increases the risk of rickets in children, osteoporosis and fractures in adults. It also helps to fight against stress, improve nerve transmission and ensure good muscle contraction. Finally, it is a key factor in immunity. What are our daily vitamin D requirements? Satisfactory vitamin D intake is estimated at 15 micrograms per day for men and women over 18 years of age. The estimated needs amount to 10 micrograms per day for infants under 1 year old and for children from 1 to 10 years old, for teenagers from 11 to 17 years old, for pregnant women and for breastfeeding women it will be 15 micrograms per day. Does all skin types produce the same amount of vitamin D? No. Light skins, phototypes I to 3, make more vitamin D than dark skins, phototypes 4 to 6, which contain more melanin, a pigment that blocks UVB rays. Age also plays a role. As we age, the skin's synthesis of vitamin D decreases. How long should I expose myself to the sun? If regular exposure to the sun guarantees, for most people, a good supply of vitamin D, it must of course remain reasonable, to limit the risk of skin cancer. The duration of exposure depends on many parameters. In addition to age and phototype, we must take into account the amount of UVB that reaches the ground. This depends on many factors. First, the season. There is on average 5 times more UVB in summer than in winter. Then the time of day. The higher the sun is in the sky, the more UVB there is. Altitude. The UV index increases by about 10% for every 1,000 meters of altitude difference. Latitude. When it increases, the amount of UVB decreases. The presence of clouds and the thickness of the stratospheric ozone layer also play a role. Another factor is ground reflection. Grass, soil and water reflect an average of 10% of UV radiation, sand 15% and fresh snow 80%. Vitamin D deficiency. In recent years, doctors have begun to pay more attention to the very real issue of vitamin D deficiency and the problems it can cause. Among the most common are severe bone pain, up to and including fractures. Vitamin D deficiency is also a major cause of osteoporosis, muscle pain and general weakness, general malaise, depression and difficulty walking. It is estimated that about 32% of children and adults are deficient and that about 50% of the population is at risk of developing a deficiency. This is due to many factors, most of which are due to a lack of sun exposure. People who work night shifts, or who live in areas with little sunlight, or those who spend more time indoors than outdoors with its tall buildings that reduce direct sunlight or even pollution that filters out UV rays are strongly advised against. Not to mention that taking certain medications can reduce vitamin D3 levels, including barbiturates and statins. Although it may seem dangerous to go out in the sun without sunscreen, using a lot of sunscreen is actually harmful because it prevents you from absorbing some of the direct UVB rays that are needed to increase vitamin D. Most doctors agree that 15 minutes of exposure is sufficient and poses little risk. How to get more vitamin D3? In addition to the general rule of getting more sunlight, there are other ways to get more vitamin D3 on a daily basis. While it's not a common nutrient in foods, in fact, most plant-based sources contain no trace of it, you can find it in the following products: milk, fortified breads and cereals, look on the food label. Eggs, especially egg yolks, cheese, especially cheddar cheese, yogurt, fatty fish such as sardines or salmon. Vitamin supplements can also be helpful. The recommended intake is 1000 IU, international units, per day, and it is important to always get your doctor's permission first. Although vitamin D3 is available over the counter, it is a hormone and should only be taken under professional supervision. A simple blood test can determine if you are in fact deficient and if you need higher than normal levels on a daily basis. When should I supplement with vitamin D? Supplementation is generally recommended for infants, pregnant women and the elderly, as well as for people of color and those with conditions that induce intestinal malabsorption. This supplementation can be extended to a large part of the population, especially in winter. In all cases, it must be prescribed by the doctor. It can be taken all at once, injection, or daily basis, drops, capsules. Do vegetarians and vegans need vitamin D supplements? If you are a vegetarian, vitamin D intake can be satisfactory, as long as you consume fish oils, eggs and dairy products. If you are vegan, in the absence of animal products, supplementation is necessary because plants contain little vitamin D and do not provide sufficient requirements. If you are not yet a subscriber to the Top Fitness Health YouTube channel, consider subscribing, and if you want to be notified when a new video is released, consider activating the little bell. See you soon for more videos. And until then, take care of yourself.